The A1C at the start of the trial was about 8.3. And as you can see from the graph, both insulin and degludec and liraglutide were effective. They got the mean A1C below 7%. But the combination had a really dramatic effect on A1C, very quickly dropping it not only down below 7, but well below 6.5 and keeping it down there. So this was probably the most effective treatment result that I have ever seen in the treatment of diabetes. Almost a 2 percentage point drop, and doing that very, very quickly, and a reduction in A1C as well as fasting glucose. So if you look at the percentage of patients who were meeting goal at the end of 26 weeks and 52 weeks, clearly it was far greater in those who were on the combination as opposed to either one drug alone. And that's not surprising, you're using two drugs. But on the right-hand side of the slide, you see the reduction in A1C based on baseline A1C, and it occurred in all groups of BMI, including very obese people, as well as people who were not so obese. They all got great reductions in A1C. The insulin dose, the total dose of insulin that was used, was less with the combination, as well as the fact that you got a change in body weight. The body weight was slightly reduced with ideglara, obviously reduced more with liraglutide alone because you used a higher dose of liraglutide and there was no insulin in those patients. But despite the better glycemic control, you got no increase in body weight with ideglara. Now, there was another very interesting finding in this trial, and it's been seen consistently in a lot of these fixed ratio combination trials, and that is on the side effect of nausea and other GI side effects. So if you look on the slide, you see that there's a very tiny amount of background nausea in patients who are taking insulin degludec. That's maybe few people getting occasional GI upsets. But with the liraglutide, about 10% of people reported nausea within a couple of weeks of starting the study drug. And that's not surprising. It's compatible with other studies with liraglutide. What is surprising is that the ideglara group had only about a 3% report of nausea, and it remained low through the duration of the trial. And the likely reason for this is that the titration is based on the insulin. So there's a very, very slow titration. With liraglutide, you go from 0.6 to 1.2 to 1.8. Here you start with much less than 0.6, and you're very gradually increasing it as you increase your insulin dose by 1 or 2 units. So this slow titration has been highly effective in reducing the GI side effects. So that was the Dual 1 study.